Hi everyone, I'm Yo and this is Vaginia. Welcome to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So today we're going to talk about a very sensitive topic, but common problem, pain during sex or intercourse. So let's get started. First, I want to let you know that you're absolutely not alone in this area. I see so many women who have this problem clinically because the fact that you're here and that you're learning about your lady parts and knowing what to do is all about caring and loving that area. So I want to thank you so much for tuning in. So please don't forget to press that subscribe button at the bottom and let's get started with the tips to share with you. For you, Vaginia and I wanted to ask you, how many of you think that this is normal? That there should be some degree of discomfort with sex or intercourse? That is not normal. This should be normal. Exactly. So there should be no regular pain during sex or intercourse for women. So let's get to the first tip. In order for you to have pain-free intercourse, you have to be fully relaxed. So all these tips are focused on relaxation. So the first tip, and you would think that it's really simple, is breathing. And breathing is really, really important, especially now. It is a very stressful time for everybody with the pandemic, unfortunately, and just life can be very stressful. So you want to make sure you create an atmosphere that is totally relaxing and gets you in the mood and facilitates as much calmness as possible. So one of the things to do is just breathe. So it doesn't have to be fancy, just let everything relax. The second tip is releasing the muscles in the lady part area, making sure those are relaxed. So how many of you out there know that there's muscles down here? So these muscles are called pelvic floor muscles. So they are muscles of the lady parts, and they are really, really important for your pelvic sexual health, which attributes to your overall well-being. Hey everyone, say hi to Myrtle, the pelvic girdle. So she's going to help demonstrate the pelvic floor muscles today. So these are the pelvic floor muscles, or lady part muscles. So they're at the bottom of the pelvis, and their job is to prevent you from leaking all the fun stuff, urine, fecal matter, gas, and they also protect your pelvic organs from falling out because they're like the bottom of a purse. So we'll go over more of that in detail on a later video. So when you're contracting this muscle, so just picture where it is, because that's really important, because you gotta know where it is for that connection, is you're getting an in and lift and squeeze up towards the front of your pelvis, which is called the pubic symphysis. So it's low, and then you want to fully relax. So as you breathe out, try to do an in and lift up to that pubic symphysis and then fully relax. It's important to let everything go as you inhale. So if these pelvic floor muscles are tight and not fully relaxed, they're gonna block your partner from going inside. And you wanna welcome your partner with open arms and not block the gate. And a lot of my clients will tell me it feels like something is blocking it. And usually it's because these muscles they're tight and you're not letting them go, or they're tight and you need a little bit more help, like seeing a physiotherapist, a pelvic floor physiotherapist. So that is my second tip. The squeeze, let go to make sure your muscles in the lady part area is fully relaxed and ready. So many women complain of pain in different areas down in that lady part region. So some women complain of pain in the opening of the vagina where there's glands called the vestibular glands, and that's at the entrance. So there's a technique to calm these nerve endings down, because sometimes they're firing and they're really super sensitive. And clearly, if there's something that wants to go in and it's touching the entrance of the door, well, what's going to happen is you're not going to like it and your muscles are going to tighten up and you're gonna have even more pain as your partner enters. So what we wanna do is a technique called desensitization. So imagine someone who's really ticklish and you want to make them more ticklish. What are you gonna do? You're gonna probably come up to them and put your hands on them lightly and they're just gonna go, ah, 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 ah. But if you're trying to calm those nerve endings down, if you just put your hand on them very lightly and they get used to the sensation, they realize it's not someone coming and tickling them, their nerve endings will actually calm down. So if your opening of your vagina is hypersensitive and those nerve endings are firing too much, what you want to do is do this technique called desensitization to calm them down. So what you're doing, or your partner can do in a non-clinical way, so he can always do some fun stuff at the same time, or you can do this as a prep to make sure things are ready and relaxed, is you just put your hand in the opening very gently till you feel the nerves just relaxing a bit so it's not as sensitive. And then you can apply different sensations such as tapping and eventually get to the in and out simulation of intercourse where you don't feel any more sensitivity in that opening. And that's called desensitization, and it actually really, really works. So then your partner can enter without any pain. So for the second technique, I find clinically and also as a home program that these tools are very, very useful. So if your muscles in your pelvic floor, your lady part area are tight, there are actually some amazing tools that work that I use clinically that really help my clients at home and also in the clinic. So here's the fun part of the video, the show and tell part that Vaginia and I are so eager to share with you that'll help you with some more tips to make that area relax, especially the muscles. So in the clinic, we use these dilators or accommodators, and it's another name for dildos that you can find in your house or you can buy in the lady part stores. And what they do is they give you confidence once you use them and you reach that size of your partner that you can accommodate your partner. So number two, it gives you control of the situation. So you are controlling the direction, the speed, and the position of the angle of penetration. And thirdly, it stretches the area. So if your lady part areas are tight, it's gonna help stretch. It also can desensitize too, which we talked about earlier. So let me show you, with the help of Vaginia, how you can use these amazing tools. So here is a small dilator, and you start with the one that you feel comfortable, but you should feel a little bit of a stretch. So what you do is you do a squeeze, let go, do your breathing we talked about before. You may have already done your desensitization, or you can do that with the dilator, and you gently put your dilator in the opening. Okay, and as you get relaxed and there's very little pain, you go in a little bit more and stretch. And then just go in as far as it's comfortable. And then you would progress to bigger ones. And you can use this as a prep for the special night that you're gonna have. So instead of using Vaginia, if I use my fingers so you can see, so this is the opening of the vagina, and you put the dilator here at the opening, and after you've done the squeeze, let go, and the breathing, so everything is relaxed, and then you slowly enter in, and then what's important is that you simulate the in and out of the movement of intercourse, so you are able to learn how to stay relaxed during the whole activity. So to complete the show and tell version of this video, as you accommodate the small size, you want to progress to a bigger one. And here are some demos of some bigger dilators that I have in the clinic. So this is a bigger one to the other size. And then here is my middle one. And this one is my regular size. Usually when you get to the regular size, you know and you're confident that you can accommodate your partner. And this is the whole goal of using the dilators. And trust me, and my clients and women that I know have used them, they can work very, very well. And again, like I said, you can use them in a non-clinical way also. Of course, the last one is applying lubrication, even though you feel that you have enough naturally. So you would think that would be something that you would normally do, but a lot of women assume that they're perfectly lubricated and they don't need anything else. So in summary, amazing ladies and men out there, the 5 tips in terms of relaxing the lady part area and getting it ready for that intimate moment would be: 1, facilitate as much relaxation through the breathing. Okay, nice, calm, slow breath, create the move, create a relaxing, positive connection with that area. So you are going to be openly receiving everything that's going on there. Number 2 was the pelvic floor muscles. So remember the lady part muscles. What you want to do is try to facilitate as much relaxation of these muscles by doing that squeeze, let go. And when you let go, remember that you're letting go of your whole body and not just letting go of the pelvic floor muscles. Number 3 is desensitization. If you have any sensitivity in the opening, in the vestibular glands, you want to calm them down by putting your hand and applying different sensations to it, because those nerves are firing way too much. They're hyper and you want to calm them down so they're ready again for receiving your partner. Number 4 would be using those fun tools that I call dilators or accommodators, or what you can happily call a dildo, and use those to stretch the area again and to give you confidence that you can accommodate your partner when the time comes. And of course, the last one is applying lubrication, even though you feel that you have enough naturally. And really, the most important thing, ladies and men out there, is just have fun. Try not to think about it. Try to facilitate that positive connection, loving your lady parts, so you are able to receive things in a calm, open way. You want to receive your guests with open arms by facilitating as much relaxation through your breathing, your squeeze, let go, some stretching with a dilator if you need to, and lots of lube. And of course, if for some reason you still have pain after these tips, please do see a healthcare professional or your physiotherapist or doctor, because there might be something else going on that you don't realize that might be helpful to get checked out. And also you might need more specific treatment by a pelvic floor physio. But just so you know, with my experience treating lots of women with pain during sex, pelvic floor physio is very, very effective. So thank you everyone for tuning in to this video about knowing, caring, and loving your lady parts. And I hope you found these tips helpful in terms of making your evening that much more intimate and pain-free. So if you've liked this video, please hit that subscribe button and please share with your friends so they know that there's help out there and how you can use these tips so you have the most intimate, fun evening with your partner like that. Thank you so much for tuning in. I wish you all a happy evening, and I look forward to seeing you with Vaginia next time. See you soon.